Hey everyone, welcome to another edition of Ask NP Deidre. Today is all about women's health and menopause and how if you don't get a handle on your symptoms early, you could really accelerate the process for cardiovascular disease. And none of us want to see that happen, right, nurse practitioner Deidre?
Absolutely. And today we have a special guest here, Kim, and she has a story to tell about her menopause journey. So I'm super excited to have her share this and really talk about what this relates to with cardiovascular disease. So,
Hi, Kim. This is Kim and Kim.
yeah. Yeah.
We have Kim Knox with us, which I hear she is actually she's been one of your patients since what, 2023, NP Deidre?
Yes.
And so, but take us back, Kim, to 2021 when you first started experiencing symptoms and felt like no one's listening.
That's right. That's right. I'm super excited to be here today and to tell my story. I've told Deidre many times I will tell it to anybody who will listen. And I a little bit of a background. I'm a nurse. I work in academia, and I have decided to get my doctorate of nursing practice. And so during my menopause journey, for lack of better words, it really led me in a direction to talk about menopause health and just start looking into those things as I began to look at evidence and what could I do that would be meaningful, that I was passionate about. And I've had this discussion with Deidre many times. Um, and since I've been doing my precepted hours at Aspire, I have seen women over and over again that repeat the same exact story that I had. And in fact, I have cried with them in the office multiple times
Oh,
because they're telling us the story that I've been there. And I really do get to touch their hand and say, you're going to get better. This is okay. You're in a safe place and we're going to help you. So it's just been an incredible blessing. And I thank Deidre so much for like taking me in as a student. I'll be with her for the greater part of the summer and probably into early fall. So it's just been really fun. But my menopause, I guess I was probably in perimenopause long before I actually realized it. I am obviously a working professional and with a family, and I just go, 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 go. Always, changing, climbing the ladder, and, didn't really ever prioritize, my health or myself. And so I think I was probably in perimenopause for a while, but it really hit me hard in 2021. Um, At that point, I would have been 51, and I, started having hot flashes, right? Brain fog, um, feeling like I just wasn't myself, and hot flashes were minimal at first, but coming mostly in the middle of the night, or it seemed like as soon as I laid down at night. And of course, feeling bad, realizing it was affecting my work. I knew it was. I went to my PCP and continued to do that over about 2 years, where I would go and he would say, well, it's menopause and you'll get through it. I had grown up with my PCP and I love him dearly. And but I think there's just a Western medicine, stigma that's around the World Health, initiative that that was published, and people became afraid at that time in 2002, I think it was, D, right? And that's when people were reluctant because of cancer risk and those kind of things, which that's been debunked now. Black box warnings have recently, as this fall, have been removed from many of the hormone therapy drugs. But for 2 years, I continued to get worse to the point that I called myself the Walking Dead. Um, every muscle on my body hurt. I had brain fog. I probably had 10 hot flashes a night. Um, I couldn't sleep. It was disrupting my husband's sleep as well, and he didn't know what to do. He was up with me, and I can't live like this. I lost control not complete control of my bladder, but a lot of it. My hips had been hurting so bad that I'd actually called for a consultation with an orthopedist. I thought I'm going to end up with hip replacements. I mean, you name it. And if it was, I had tachycardia, um, it was just, it was all related to hormone therapy. And he offered me, antidepressants, which when I started looking into, you know, menopause, a lot of the studies show that that is what happens to women. The majority of women that are seen by their primary care providers, so it's just menopause, and they'll get offered an antidepressant, and which is what happened to me, which doesn't help. All you're doing is, you know, giving an antidepressant that might make you sleep a little bit, but the hot flash is going to wake you up. I mean, it was no help at all. And yeah, so from there, um, finally, my wonderful daughter-in-law who works at Aspire, she knew Deidre and she got me hooked up with her at the end of 2023, where finally someone listened to me. And, I think I cried in that very first consultation. I feel like Deidre saw the top of my head. Um, more than she saw anything else. And so it's just it was a pivotal time. And from then, doing the lab work, getting put on some good bioidentical hormone therapy replacement, having someone listen, having someone look at my labs and titrate, to see how I was doing, it's changed my life. I mean, completely changed my life.
So
Um,
Deidre, bring us back to that first
yeah.
meeting. Do you remember that first consult with Kim? Can you tell us a little bit more about the conversation that both of you are comfortable in sharing?
Yeah, so I do remember that first conversation that we had. And part of that is I remember Kim talking to me about like family history as well and this concern for cancer. She had never had a cancer herself, but there is this family history. And so that's where a lot of fear comes in. And so, we talked through things. We tried some herbal stuff first because I do believe in meeting a patient where they are and educating until they have a comfort level for this, and doing bioidentical hormones. But we have such an opportunity in women and the perimenopause and early menopause before that 10-year window to start on bioidentical hormones for the cardiovascular system. Like, we know the earlier we start, it's a prevention tool. We can prevent cardiovascular events in women. And hands down, we know over breast cancer, cardiovascular is the number one thing that women die of every year.
And so was this something, back to Kim, before you saw nurse practitioner Deidre, were you on hormones and then needed the antidepressant, or
No,
was the
it's interesting because one of the studies that I did, it aligns with what happened with me. There was a study in Germany where 82,000 insurance records were evaluated in this cross-sectional study, and 79%, 82,000 women had hormonal menopausal symptoms. 21% received hormone therapy and 79% did not. I mean, that is pretty telling. And that was where I was. Most of those women, were offered, like I was, antidepressants, which does nothing for the symptoms. So this cardiovascular protection was something that came as an added bonus because my quality of life was very, very poor at that time. And, improving my quality of life along with, improving, my, decreasing my cancer risk and decreasing the cardiovascular risk was just added bonuses. So,
Deidre, is this something that happens to every single woman? I mean, from perimenopause to menopause. I mean, is it, are the symptoms that drastic?
They are, for many women, they are that drastic. And so Kim's story is she's a career woman, right? She has a job that has high needs. She's managing many things. So when we think of what happens to women in these high careers and they're really managing their homes, their families, and everything, your adrenal glands in menopause, think of them as they are your ovaries of menopause, your adrenals. So when you are stressed and not recognizing that you are stressed, which most of us can go about saying, we're not stressed because we've adapted to it, but that's not what's happening in the body. The body is saying otherwise. So they have a harder transition. So when you are stressed, your body is under stress, you have a harder transition in menopause. That's what we see kind of across the board. It happens all the time. But this story of not being heard and nobody recognizing, like she said, an orthopedist, a primary care, like how many people do we have to see to connect the dots? This is a menopausal issue. And that if we address the menopause portion of this, we start to improve not just quality of life, but we're improving brain health, we're improving bone health, we're improving cardiovascular health. So that's the importance of us as practitioners listening to that and like helping navigate.
But I think it goes beyond that, because I think what Kim also you were saying is that the doctor said, it's likely menopause, kind of brushing it off. I know I've had that experience with my PCP, likely perimenopause, as if it's just normal. Like, let's not have a discussion. Is what it is, something you just have to live with, and no further discussion. So I think they recognize that it's something, but they're not following through with it. Or is it just like a catch-all for someone over 50 and they don't really understand it?
So for many years, probably 20 years, providers were not trained in menopause because of that World Health Initiative that made us fear that hormone replacement was going to cause a cancer. And so we have 20 years of providers who were never trained in hormones to understand the interrelationship between all of the other systems when it comes to hormones and like the whole body, whole person. And so when you see somebody, I mean, in a primary care world, they are so taxed with so many different things that they are having to do, and they have maybe 5 or 6 minutes to spend time with you. And so I feel like a lot of things do get dismissed. I was even dismissed prior to my open heart about my symptoms of things that could have, a spontaneous coronary artery dissection. We know, looking in literature, is women in before the age of 40 who have severe hormone shifts. And so that's why I'm such an advocate of like knowing my story too, of having to have open heart surgery when we probably 20 years before that could have been doing some prevention. And so I feel like hormone therapy, like it's going to take a long time for everybody to catch up to the 20 years of lost education. So,
But we don't want it to be where it's someone that's everyone just looks at it as it's an age thing. Okay, at 50, and only when you're 50, then we'll talk about it. Then we'll start looking for symptoms, because different people, it sounds as though, have a different presentation or of perimenopause and a different timing of it than other people. And we don't want it to be like, for example, with peripheral artery disease, where people who are in their 30s say, hey, I have these leg cramps. They say, go home and drink some extra water and get some electrolytes, maybe a little potassium or magnesium. You can't have PAD without testing. So I think that would be the same thing, like in your case, where you were in your 40s, but you might have had perimenopause or some symptoms of that prior to that should have been taken a look at.
Mhm.
exactly, because women can have perimenopause. I mean, I have women in their 30s that I'm
Yeah,
seeing
okay. That's what
perimenopausal
I'm saying.
symptoms. And so we have such an opportunity to, improve those cardiovascular risk by listening to that story and optimizing hormones in whatever way that is. It isn't always like doing hormone replacement therapy, but many times it is.
And so, Kim, what are you studying? At what point did you shift from, okay, I have this, I'm now on the right track. Deidre's gotten me on the right track. I want to get more women on the right track.
Yeah.
Walk us through that transition, that
Mhm.
aha moment for you.
Yeah. So, back in 23, I was kicking around getting my doctorate, continuing school, and had just gotten on the right path, started feeling better, which if you're listening to this YouTube and you have those symptoms, you don't have to stay that way. You can feel better. There are things, don't ignore those symptoms. But my mom suffered for 7 years with menopausal symptoms, and I mean severe. She had hot flashes and the aches, the achy joints, the achy hips for 7 years. And I just think that's a travesty that those 7 years, were during that period of time where there was fear across the world about hormone therapy, and she had to suffer through that along with millions of other women that has. And so, when I thought about getting my doctorate, I didn't want to do something that was just choosing, a topic, a research project to implement that wasn't meaningful. And so it's very meaningful to me because it happened to me. And, I'm going to be implementing a screening tool at Aspire Wellness, for um, 35 to 67. And I hope that I can spread this to my PCP and take it to his office and say, okay, look at this tool. Look what it showed, even in a functional medicine clinic, and just be able to spread the word that way. So I guess I could say my passion lies with the couple years that these symptoms took away from me and my family. I have 6 grandkids, and I want to play with them, and I want to be active, and I was absolutely miserable. And so was my mom, in those 7 years. And so that's why, I chose to go this route.
Can you talk about the research that went into designing this screening tool and the elements of this screening tool? Just your method to your madness
Oh gosh.
on
Okay.
it.
So to in
I
a
can see that passion. It's coming. Here we go.
Yeah,
I'm so excited.
so to be able to implement a project or a tool, it has to be there has to be enough evidence to show across the world that that tool was used in very, very high level, which is too deep for me to get into, but level one studies where they've actually used the study at work. And so we're going to be implementing what's called an MENQOL screening. And with that, with implementing that, I had to, look and find not all the research because there's more than I could even find on quality of life for women. I mean, it's in abundance out there. There's so much research around, and it's funny because this research has happened within the last 5 years or even before that. So while this research was saying, look at the signs and symptoms, these women don't have depression. Look at you know the quality of life. Look at women leaving the workplace after the age of 50 in droves. There was one study that showed 70% of these women that were polled had left the workplace around like the age, I think it was 50 to 52. And when they went back and they looked at those women, they left the workplace because of menopausal symptoms. And it was going to happen to me. That was happening to me. I felt like I was losing a grip. I wasn't who I was before. So there's just so much research and evidence out there that supports the need for providers, educators to understand that menopausal symptoms need to be looked at individually and per individual patient, and um, you know and not just blanketed with, oh, that's perimenopause like you've heard, or that's menopause like I've heard. So yeah.
And so, what are those key symptoms? Can we just spell them out for
Yeah.
people so that we understand? It's not that you want to sit there and I just don't like when you go to the doctor and it's just a cop out and they won't do any investigation because you're at a certain age. And maybe more likely than not, that fatigue is coming from perimenopause or menopause. So they don't bother checking your B vitamin levels or anything else. So, that being said, that's not the reason I'm asking. I just want to know what are some of the standard symptoms so that people know perimenopause to menopause that you're screening for.
So you're
The
looking at vasomotor symptoms, which are hot flashes and night sweats. Some people at night don't feel hot, they feel chills. So if you're having disrupted sleep at night, have trouble falling asleep or staying asleep, that's a hormone disruption many times in women, especially if you have slept well your whole life. Some of the other things that we look at is like brain fog, inability to like remember the tasks that you've been doing, or you're like really struggling reading a paper. And so sometimes women will get edgy, is what I say, and they'll get told that it's depression or anxiety. Some of that can worsen. I've had many patients have extreme anxiety in menopause as they transition and everything, and it's because of those hormone imbalances. The joint pain that Kim spoke about, like that is very common. Women will talk of that deep hip pain that they're having, and it's deep in the joints and such. Just feeling less energy, decreased libido. They may have vaginal dryness, pain with the intercourse. Like there's so many symptoms that kind of get dismissed. Recurrent urinary tract infections because the vaginal walls are thinning. So those are all menopausal symptoms. So you have the genitourinary, and then on a daily, we hear about women having heart palpitations, right? And we know heart palpitations all the time. We're just told, like, oh, you might be throwing some PVCs. This isn't a big deal, but it is a big deal to the woman living with these constant, every other beat is an added skip or something. Like it makes you anxious. It makes you feel like you have decreased energy as well. And so,
Yeah, and
Wow,
let
I'm
me
just
add,
thinking,
sorry, I just want to add that
yeah.
imagine, all of those symptoms, having all of those, and then waking up in the morning and having acne, and your skin has broken out and you can't control why you're breaking out at 51 and your hair's falling out. And so you're losing your hair and your skin is terrible and you're exhausted. So imagine like how you feel, as a woman trying to be a professional and carry on with day-to-day, activities. It's a pretty low place to be. So, yeah.
As you both are talking, I'm having this flashback to a patient that I've been dealing with for a few weeks, and I was in the meeting with her with the cardiologist, and she was talking about having those PVCs,
mhm.
and she was saying, "Oh yeah, I have this rapid heart rate," and the doctor's like, "Oh, they're just PVCs, like no big deal." Like they're no big deal, but yet she's experiencing them. And I'm wondering, she's already had her kids, everything else. I'm wondering if it is a hormonal issue related to menopause. And that's something that I'm now going to say, hey, you might want to talk to your primary care provider about this. So, or call nurse practitioner Deidre.
Yeah, I'm finding someone like maybe in her area that specializes in hormones, because we've always thought notoriously that our OBGYN is the person to go to for your
Oh,
menopause symptoms.
yeah.
And we know like they don't have a lot of endocrine training, so not all of them are even comfortable prescribing hormone replacement therapy. So finding somebody who's specialized in it and not just somebody who's saying now offering it because the black box warning. You want somebody who knows the nuances, especially for our cardiovascular patients. Like they want to be considering where you are in your age, where you are in your journey, what your cholesterol levels and your inflammatory markers looking like. What is that history of you personally, and where does HRT fit in? Because somebody who's had a clot or is at risk for a clot, we would want to use topical, bypassed, like no oral, because we want to bypass the liver. So there's those nuances. You want somebody who's well versed in that, but start the conversation somewhere for sure.
Yeah, definitely. So where do we go from here in terms of implementation, awareness? This is something that I would imagine would be, as you said, Kim, this is a study. It's going to start there. You're going to get the data and hopefully going to be able to roll it out somehow once you prove your theory and your concept.
Um, Yeah, I mean, so like right now, if you're asking, like right now, I'm in the process of kind of watching the screening that's happening at Aspire and how that's done. And then, in the weeks to come, I'll implement that tool, and we'll look at what symptoms are documented in the medical record, keep track of those, and see what the difference is between what it was prior and then what it is afterwards. So that's kind of our next steps. So.
It's interesting on YouTube. We have Lisa that's saying that doctors just tell us we're depressed, and that's demeaning,
Mhm.
right? For women, how could that many women be depressed? Pretty much every woman. And
Mhm.
we still haven't, like, literally, the light bulb hasn't gone off in a grander fashion yet. How is that?
I think it's going to take a long time for Western medicine to catch up, right, Dee?
I do. I think that even though we have such great momentum right now, it's being talked about across the board. There's a lot more trainings and everything, but yeah, it is demeaning because, depression doesn't always just happen to women, right? It doesn't always happen like that. When the hormones imbalance, that is when our mood is affected. Progesterone directly affects your mood and your GABA receptors. So I would say women can get edgy, but we can't call ourselves crazy.
I mean, when it gets to that point, I mean, did you have people thinking you were crazy? You were saying that you thought you were crazy. Like, what is going on here? I can't control this.
Yeah, yeah. You just feel like your life is spinning and it's just out of control. And in my heart of hearts, I knew I wasn't depressed. I knew I wasn't depressed. I knew that it was, if I did have, some symptoms of depression, it was because I was not sleeping and because I hurt all the time. So, it's just, I mean, truly just such a blessing that, my path led me, to Deidre, where I could, get some help and then be a voice for women, because they do think they're crazy. I mean, I've heard it repeatedly, even in the short time that I've been at the office, where women will come in and they'll just say, "I'm not myself anymore." The relationships change between, you and your spouse. I mean, it just really does affect everything. So, but hormones are powerful. I mean, it affects everything we do, and you know so it just needs to the word needs to get out, and I think it's just going to take time.
And so you have another degree here in the works. Talk about that, what it's going to take to get there. And I imagine that all of this work that you've been doing, all of this research is going to go into practice when you hit the next level.
Yep. Yeah. So, for my degree, I have to have 1,000 practice hours, which is a lot. And I don't know, I'm somewhere around 400 right now. So, that's practice hours at the site, and it includes, some of the research that I'm doing. So that's sort of how that will play out, and continuing to do research, and when you're in school for your doctorate, the different classes kind of lead you into a deeper and deeper research path. So I think some of the path I'm not like 100% certain of what's going to happen to me, in the weeks to come, and what they're going to have me research, what they're going to have me do. But right now, that's my trajectory is just, spending time in the office, looking at practices, and kind of submersing myself in data, and I think that Dee would like to like actually research herself, right, with some of this work that I'm doing.
Yeah, I want to implement it into our practice, see where it falls. Like, I want to, for me, I see a world like what I can do is train other practitioners.
Hmm.
Like all the work I do with patients is lovely, but if we don't change it from a practitioner standpoint, like that's where our impact's going to be. Like training like new graduates and other providers who aren't as well versed. To me, that's where the impact is going to lie because if they start to understand with these tools and how this makes a difference, and looking at like the cardiovascular, so the cholesterol levels can stay normalized if we're not going through menopause and dropping estrogen? Are they having less heart symptoms? Like, what does the vascular system, like, what's happening there when we do those, CT calcium scores and everything? How does that improve with menopause hormone therapy? And that's where I want to keep looking into this and sharing this. I have the opportunity to speak at a conference this year, and these are things that I feel are going to be able to be shared and be able to change how we care for women.
Yeah. So my project will get published, Kim, and then that's one little piece of the work that's being done around the world. So that'll just be one more thing that's published, in that direction of you need to screen, you need to start, assessing women the way that we deserve to be, assessed. And that'll be published, and then, Dee can take that and then she can, educate further. So.
And I actually am foreseeing a foundation being formed
Of powerful women.
of powerful women going to Capitol Hill and advocating for big dollars for additional research and for early testing and getting the preventative. I think it's like what is the preventative disease task force to buy into this early screening, showing that the benefits of screening early outweigh the risks. If they can do that for breast cancer with a mammogram that exposes women to radiation every single year with every single one of those, and say that the benefits still outweigh the risks, I would think this would be a breeze. Just get the Susan G. Komen Foundation on board, and then start your own foundation to literally align and join forces to hit Capitol Hill.
Yeah.
That
And it
sounds
is
great.
going to take a big voice from many of us, and you're seeing it more and more out there in the, influencers and providers, and like you're seeing it, but we're going to have to keep at it. Yeah.
Mhm. Yeah.
Awesome. This has been incredible. Am I missing anything, NPD? I love
No,
that. I'm going to start calling her NPD.
yeah, yeah, no, this is incredible. Kim, thank you for sharing your story with everybody, because every time we have the opportunity to share a piece of ourselves and connect with somebody, you change somebody's life inadvertently. It always happens. And so I'm a believer in like sharing the hard times, because if you don't, like, life is not rosy in that perfect Instagram. This is the real world, how this really affects women. So we appreciate you.
Yeah.
Yeah,
Yeah.
we definitely do, and would love any updates we can get. Maybe checking in with you once a quarter and seeing what you're up to, seeing what you've discovered. Patients love following you, along your journey, and they feel like they're a part of your success, but you're a part of their success too, because
Mhm.
you're helping to spread the word, and it's going to have an impact. It already is, I would imagine, with so many people even tuning in right now, and more that are going to be on replay later on. So thank you so much, Kim Knox, for your courage and sharing your story, but using your experience to create the change that you want to see, and we all, it turns out, want to see. So we're all behind you. And make sure, I would love to hear in comments from anyone else who's had this experience. Women, shout out. Let's hear what you have to say. Would love to hear what resonates with you from this conversation. So get that in comments. If you have any other questions, if we get enough questions in, we'll do another show sooner rather than later and get her back on. But we have NP Deidre every week, and you can always go to our YouTube channel, youtube.com/the Ask NP Deidre. You can also go to our website, Aspire, ASPIREWIH.com. And you can also visit with Kim Knox there as well, it turns out, and maybe get involved in their project and get screened. Be one of the first to try out this new screening tool and be a part of the change. Help create the evidence that we need to get this screening tool more widespread. Also, don't forget to like this video for more great content like this, and subscribe to our channel at youtube.com/the @ the way to my heart. Thanks everyone for joining us.
Thanks.